Health equity for us here at Morehouse School of Medicine means giving an individual what they need, when they need it, and the amount that they need for them to have optimal health potential.
The vision of the Morehouse School of Medicine is leading the creation and advancement of health equity. The American Public Health Association's theme this year is creating the healthiest nation, ensuring the right to health. The two are very closely aligned. Health goes beyond the health sector, what we can do. We train excellent physicians and scientists and public health leaders here, but we recognize that health is not created within the health sector, that health indeed goes into addressing the conditions in which people live, work, play, their neighborhood conditions, their individual context of poverty or wealth.
The question of health equity is such a critical one. It's and it's brought us a long way since we first became involved with the concept of health disparities, which sort of is about leading toward equality. I think health equity goes further and says that everybody should have the opportunity to be healthy.
The Transdisciplinary Collaborative Center for Health Disparities Research, or the TCC, which is commonly called, is an institution-wide health equity-focused policy research center at Morehouse School of Medicine. The TCC was founded on the principle of collaboration and nurturing strong partnerships, most powerful and strategic and effective ways of evoking changes and promoting population health.
The TCC is focused on informing policy and advancing health equity in four main areas: childhood development and quality parenting, the integration of mental and behavioral health into primary care settings, health information technology, and health policy leadership.
The guiding principles of the TCC really focuses on the first major emphasis is on health equity. We are looking through the lens of health equity. The reason being that we have significant problems with health disparities, many underserved communities, and we wanted to ask the question, how does policy that's enacted in the context of health and healthcare impact these individuals? We also have a second principle around collaborations and partnerships. This is critical for us because this center builds on a lot of the research that's happening around Morehouse. And so we bring all of these individuals together to impact and work with communities around policy.
We're currently partnering with 13 states to implement a quality parenting program, one of our signatures here at Morehouse School of Medicine, called Smart and Secure Children. Smart and Secure Children is a community-based parenting program that was developed by parents, facilitated by parents for parents. And the goal of the program is to have kind of a conversational style engagement with different parents around topics of interest such as child brain development, how to effectively discipline your child, physical activity and nutrition, how important and fundamental reading is to children, in a format that really empowers parents and gives them information in such a way that they can carry out these skills with their children.
REACH High stands for Racial and Ethnic Approaches to Community Health, or the REACH Initiative. REACH High is based on a community-based participatory approach, and we see this as a unique niche here at Morehouse School of Medicine, where community residents and leaders are there to plan, implement, and evaluate any approach that we develop to address community health. But it's about looking at the policies, systems, and environments that shape or serve as promoters of health. And we see that as getting ahead of the risk. We're doing this by partnering with corner stores, which are frequently the only place where a lot of our communities get their primary nutrition. And we're doing this through ensuring that corner stores see the value of offering healthy options at these corner stores.
As Surgeon General, I had the opportunity to release the first ever Surgeon General's report on mental health. And the major recommendation in that report was parity of access to mental health services. It's been a major issue. People with mental disorders end up in jail sometimes easier than they can get health care. And so that was our target, parity, equity of access to mental health services. Hopefully, the Kennedy Center for Health Policy and Research will lead us in that direction. But more important, it will be an opportunity for our fellows and students to really learn more and become confident about their ability to influence policy, to implement policy, to really see policy through.
Partnerships and collaborations are central to the work we do here at Morehouse School of Medicine. These partners must be in communities, must be in clinical care, but they also must be in policy, systems, and environmental change. Our three-pronged approach is central to advancing health equity because not only do we have high touch, a strong evidence base, but the partners and collaborators that are critical to us advancing health equity.